Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. The Invos monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on the utility of Invos system. Does skin pigmentation affect NIRS readings? To help answer this question is Dr. Ronald Bronicki, Professor of Pediatrics at Baylor College of Medicine, Section of Critical Care Medicine and Cardiology at Texas Children's Hospital.
NIRS oximeters, like pulse oximeters, rely on the application of the Beer-Lambert law. The Beer-Lambert law enables us to measure the concentration of a substance, in this case oxygenated and deoxygenated hemoglobin moieties, in a medium, in this case tissue, based on hemoglobin's absorption characteristics. The Beer-Lambert law considers light intensity and light detected to determine light absorbance. It relies on a known distance traveled by the light, or path length of light, and last, the absorption coefficient of the chromophore, which depends on the wavelength of light and oxygenation status. At least 2 wavelengths of light are needed to measure the concentration of chromophores. Near-infrared light with wavelengths between 700 and 850 nanometers are used because the absorption spectra of oxygenated and deoxygenated hemoglobin are maximally separated. Modification of the Beer-Lambert law is necessary to assess the concentration of hemoglobin because of tissue-induced light scatter. As depicted in this figure, light scattering results in variation in the path length of light and the loss of some light which is neither absorbed nor detected by the light detector. The modified Beer-Lambert law relies on correction factors to account for the impact of scatter. This cartoon depicts the Invos oximeter probe. The probe has a LED on one end that emits near-infrared light. The near-infrared light is used because it is able to penetrate bone and in doing so assess tissue oxygenation in the underlying brain parenchyma, 1 cubic centimeter of tissue, some 2 to 3 centimeters beneath the probe. 2 photodetectors at separate distances differentiate the signal arising from superficial tissues, in this case, the soft tissue of the scalp, and deeper tissue, in this case, frontal lobe, the signal that we are interested in. This technology is referred to as spatial resolution. NIRS oximetry measures the absorption of light by hemoglobin moieties in the entire tissue field, subtracting the pulsatile signal. The signal is processed and a mean oxygen saturation is generated. Because the majority of blood by volume is venous, the regional oxygen saturation is viewed as a surrogate for the venous saturation of that viscera. The proprietary algorithm which processes the signals relies on several assumptions. The scatter-induced variations in light path length and light loss are not overcome by incorporating the correction factors. Furthermore, spatial resolution does not completely eliminate contamination of the signal by the superficial tissues. And the proprietary algorithms rely on an assumed proportion of arterial and venous blood in the tissue field. For these reasons, there is inter and intra-subject variations in readings. As a result of these limitations, NIRS oximeters measure changes in hemoglobin concentrations from an arbitrary baseline. And for these reasons, NIRS oximetry is cleared by the FDA as a trend monitor. However, as reflected in this study above, NIRS oximetry readings have been shown to closely track changes in regional venous oxygen saturations. Melanin is the primary pigment in skin. It absorbs near-infrared light. The more melanin, the more light absorption. The absorption of light by melanin results in an underestimation of tissue oxygenation. Pulse oximeters are also affected by skin pigmentation. As melanin increases, pulse oximeters increasingly overestimate tissue oxygenation. The extent to which melanin confounds the reading is unclear. Studies have demonstrated that there are several factors, such as the presence of cardiovascular disease, which affect baseline cerebral NIRS readings, and thus the extent to which baseline values differ between individuals. This is an important consideration, whether or not one considers skin pigmentation. Another confounder in the relationship between skin pigment and NIRS oximetry readings is that skin pigment content is on a continuum. Additional wavelengths of light would improve the accuracy of NIRS oximeters in patients with skin pigmentation. However, the increase in accuracy comes at the expense of a decrease in responsivity of the oximeter to changes in tissue oxygenation. In any case, variability in individual patients and between patients is relatively unimportant because, as we discussed, regardless of the amount of pigment, the algorithms, limited by the assumptions made, measure changes in tissue oxygenation from an arbitrary baseline.
Thank you for listening. This is the conclusion of the Utility of Invos System podcast series. Please tune in to other series from Medtronic MedEd Learning Experience wherever you find your podcast.